First, I'm going to check the orders. I'm going to gather my supplies, enter the room, close the door to provide privacy, wash my hands, introduce myself, and raise the bed to a working height. And after that, I'm going to explain what I'm here to do. And what I'm going to start with is patient orientation. I'm going to know if they're oriented X4 to person, place, time, circumstances. I'm going to do a pain assessment. I'm going to ask them if they're feeling any pain. Is it radiating on a scale of 0 to 10? How bad does it feel? When did the pain start? Are there any circumstances that alleviates the pain? How frequently do they feel the pain? And then I'm going to start with vitals. I'm going to start with taking their blood pressure. Let's say it's a 118 over 68, which should be normal. I'm going to check the patient's temperature. Let's say it's 98.6, which is normal. And I'm going to check. I'm going to check skin turgor now, less than 3 seconds. I would do that here actually, less than 3 seconds. I'm going to check. O2 stat. I'm gonna get their O2 stats 99%. I'm going to temperature. I did a pain assessment temperature, and then I'm going to do skin and wound assessments. I'm going to note that their skin is intact. It's moist. It's warm, not overly warm or cold. I'm going to note that this patient has a wound. The edges are well approximated. There's no tenderness. It's a little red around the edges for the color, like chemoses. There's no odor. There's no purulence. There's no drainage. And the dressing is intact. Let's see. Wound, skin. And then I'm gonna, this patient doesn't have an ID, but if the patient did have an ID, I check for patency, that the ID is intact. I check to make sure there's no drainage. I would check to make sure it's running. I'm gonna note now this patient has a tracheostomy. With IV, I checked all that, and I'm going to check the same thing with any tubes, like any drainage tubes. With the drainage tubes, you're going to check for odor as well as everything else that I checked with the IV. So I'm going to start with start with the head for heat. So the head is normal cephalic and proportional to the body. I'm going to say that and that's something that I noticed for for head, ears, eyes, nose, all that stuff is like normal symmetry and proportional to the body. And then for the hair, I would know there's no vermin. The scalp, there's no scars or lesions. For the ears, I'm going to check and note that the pearly whites are present, and coronal light 5 o'clock on the right, 7 o'clock on the left. I'm going to note that there's no scars or any damage in the ears. For the eyes, I'm going to do a vision acuity test, and then ask the patient to tell me how many fingers I'm holding up for vision acuity. I'm going to ask them to move their eyes down to check the conjunctiva is pink and moist. And then I'm going to do a sniff test with the nose with alcohol swab for acuity. And look up the nose and notice there's no scars or lesions, and the mucosa is pink and moist. I'm going to ask them to say and note that their palate rises and falls intact midline. The tongue is midline, intact, no signs of any scars or lesions, no exudate, no caries, and the ask them to move their lip down, or move their lip down, and notice that the mucosa is pink and moist. No exudate or scars or lesions. And okay. Next I'm going to do cardiac and respiratory. I'm going to note that they have a trach. I got to do neck. So I'm going to note they have a trach. And I would see if the trachea moves. It's non-rigid. They have a tracheostomy. I'd listen for breath sounds, and they have breath sounds. And no signs of any trauma or infection around the tracheostomy site. I'm also going to note that their thyroid is non-palpable. Okay, moving on to cardiac. I'm going to listen to, on the right side, second intercostal space, aortic, left side, second intercostal space, pulmonic, S1, S2, and then Erb's point, third intercostal, sternal border, S1 and S2 you can hear, that's where you can hear the best. And then tricuspid, fourth intercostal space on the left side. Fourth, and then fifth intercostal is mitral valve on the side here. And I'm listening for S1 and S2 is intact, no S3. And then I'm also going to check a radial pulse. It's 70 beats per minute. And then I'm going to go to respiratory. For respiratory, I'm listening for resonance, high resonance air, low resonance dullness fluid. I'm going to listen to 5 points in the front here. So I would listen to 1, 2, 3, 4, 5 on the side. And on the back, there's 9 spots I've listened to. I'm starting here, 1, 2, all the way down here to 9. And what I'm listening for is resonance. High resonance again means air. There's no fluid in the lungs, and that's what I hear. So, and then I'm going to do feel for tactile fragmentus and ask them to say 99 as I move my hands down like that. And then after that, I'm going to do abdominal. So there's 4 quadrants, and first I'm going to listen for like the frequency of bowel movement of peristalsis, and I should hear 10 sounds as normoactive, below 10 is hypoactive, above 30 is hyperactive bowels. And I'm also going to do a GU assessment and ask them if they've how often they urinate, if they're having any pain with the urination, ask if there's what their frequency of urination is, and if there's any signs of redness, which would be hematuria. But I would say redness, ask if there's any redness to their urine. And I'm also going to palpate and notice that the abdomen is soft, and there's no tenderness. The chest is symmetric, and when they're breathing, their chest is rising and falling symmetrically. So with the abdomen, I'm feeling for the soft. There's no boarding. Okay. And then for neurovascular, I forgot neurovascular. I'm going to. I'll do that one last. I'll do musculoskeletal first. So musculoskeletal, the patient is in the bed, so they can't really get up. So I would assess everything, and their movements would be passive. I'll assume their movements are passive, so I would move their legs to assess legs, ask them to invert and evert feet, and I'd also ask them to resist movement, so I could assess muscle strength for each limb. For arms, I'd ask, for shoulders, I'd ask them to move their arms out and in to assess shoulders. I'd ask them to flex and extend and resist movement for strength, and to test grip strength by gripping my fingers. and note that their grip is strong and equal bilaterally. And I'd also ask them to move their head if they could to the side to assess head, and also assess head strength, ask them to resist movement. Okay, I'd also assess, so we're gonna do neurovascular. Okay, so pulses, check all the pulses, radial, brachial, carotid one at a time, so you don't include. And then there's inguinal, then there's popliteal, dorsalis pedis, and then tibial, I think, yeah, tibial, dorsalis pedis. And I almost forget things with neurovascular. I think I forgot the skin. Okay, I'll probably remember it if I just come back to it. So, I would, so I'm going to make sure I do my post-procedure steps. I know I forgot something, but I want to say the post-procedure before I forget that as well. At the very end, I would lower the bed, hand them the call line, and explain that I'm finished, and that if they need anything, they can push this light. If they need anything, and ask them if they need anything right now. I would clean my equipment, take my gloves off, wash my hands, clean my equipment, and then tell them when I would be back. Oh, I forgot to put the side rails down in the beginning, and now I would put the 2 side rails back up, but not 4 because that would be a restraint after I'm done. And then do all those other post-procedure steps, and then I would wash everything, document, explain when I'm going to be back. And then I don't know, I can't remember. I think that's everything.